Remember you said we should not hold. Yeah, that bladder should not hold mpaka inaanza ku overflow because you are waiting to finish what you're doing. No. So women of pregnancy, which is also a women thing, also predisposes them through that direction. Because when there is that laxity of the organs, yeah, and bladder per se, there is over retention of urine there, which can predispose to growing of the bacteria and hence the infection. We've really talked about this toilet habit.
Yes.
Yeah. Wiping backward is a must. Maybe I can start. I said 5 commandments. I can now reveal what
now
they
bring
are.
The commandments.
Yes. Commandment number 1.
Yes.
Wiping
I'm counting
backward.
with you. I'm talking.
Wipe backwards. Never forward.
Front, back.
Yes. Front, back. Front, back. Yeah. And never the other way around. Please. Yeah. Whether it is a small baby, it is a potty baby, or you are an old woman, the routine remains forward, backwards. Back. Yes. Never the other way around. That's number 1.
First commandment.
Yes, because you do not want to take that commonest bacteria to the front. Because when it goes to the front, we've seen it goes to cause problems there.
Itaingia?
Yes, it will cause urinary tract infection. Number 2, we've talked about honeymoon. It's not always that people do those things in honeymoon. In marriage, these things do happen, okay? So, for women, before and after, make sure you empty your bladder. That is commandment number 2.
Commandment number 2, empty your bladder after intimacy.
Before and after.
Before and after.
Yes, before and after. Make sure you empty your bladder. Okay, that is number 2. Number 3, yeah. Number 3, we always say, do not hold urine. So keep emptying your bladder. Keep emptying your bladder. When you're doing that, you're doing what you are calling bladder washout. Yeah. So you're not giving bacteria an environment to flourish. So keep emptying your bladder by not holding urine. Don't have that habit of, let me finish, let me do this, and then I'll go. No, don't. Number 4, yeah, it is always advisable to use a white tissue. Yeah, for those who wipe, for those who use tissues, a white tissue is the best because a white tissue will be able to see even if you have maybe vaginal discharge or you have blood or something that is abnormal, you can see it on a white tissue as compared to other colored tissues, okay? And for those whose maybe religion maybe calls for using like kitamba, use a white one. You can always be able to pick up abnormalities in a white background than if it was colored. And even if it's also to clean yourself, the routine is always like that. For those who use water, please forward, backward. Is it front, backward, and never the other way around. So even when you're cleaning your body, that is the route. The other one is taking water. Drinking a lot of water. So drinking a lot of water will not only avert constipation, our past topic.
Yes.
Yeah.
Yes.
It will not only help clean blood, we mentioned it that time.
Yes.
It will not only give life to the kidney because it is helping the kidney to function. And the kidney that cleans the body and the blood, yeah, the system. It also helps you to keep urinating more often. And in urinating more often, you're still doing bladder washout. Are you getting that? Don't confuse it with that one of not holding. Yeah, because maybe you just took 1 cup of water and tea in the morning, bladder imejaa, yeah, na utaki kwenda, wacha nimalize, wacha ni sign hizi forms, wacha nimalize hii mboga, don't hold. just go empty and come back. But there's this 5 we are saying, drink water so that you also keep filling your bladder, and when you fill your bladder, you'll feel the urge to go and empty. In emptying, you're doing bladder washout, which is keeping you're destroying the environment of the microorganisms to flourish and give you urinary tract infection. So those are the 5 commandments.
5 commandments.
Yes.
Tumeziona. Tumesisikia.
Yes,
na tutashika.
So when you keep those in your mind, as a woman, you'll be able to. And remember, when you said forward, backward, we're also saying for our babies, the baby girls, even our baby boys, everybody, that should be the routine.
Yes.
Whether men or women, it should always be backward, never the other way. Because even if it's a man, as much as the urethra is wrong, it can still bring the poo-poo to the urethra and make the microorganism to pass. Yeah, some may be fought by the prostatic secretions, but some may still gain their way in. So you should always from front to backward.
To back.
Yes. I would want us to understand what is the difference between STI and UTI. Yeah, this is a question that raises so many questions, and like I was relating it with the honeymoon UTI, it's because the honeymoon UTI is always confused for what? For STI. Yet the man is not complaining. The man has no problem. Yeah, if it is UTI, then you should be having it, the both of you. The man should be screaming when he's passing urine. You're also screaming when you're passing urine, but that's not the case. UTI, it's yours and yours alone. It is man's and man's alone. Okay, it is an individual entity. It's only that now in those kind of circumstances, like now in the honeymoon or during sexual intercourses, the man may act as a vehicle. Yes, may act as a vehicle to make the microorganism get into the urethra. Yes, then when it comes to presentations, they may have some similarities, like a person with the STI may complain of low abdominal pains, okay? But mostly you find your STIs will come with discharges, yeah? And these discharges, if it is a man, mostly it will be urethral. But if it's a woman, mostly it will be vaginal discharges. Yes, and these discharges can be variable. Others will be greenish in color, others will be yellowish in color, they will be foul smelling. Yes.
Depending on what
the kind of microorganism that has caused that bacteria. So what we are saying is STI and UTI, they are different. UTI is an individual entity. It's your own disease. It's my own disease, okay? There may not be crossing over. But STI, when you have intercourse, you are able to transfer it or to transmit it from one person to the other person. That is also a strong point that we need to catch. Then we said, in addition, for example, let's use an example of gonorrhea as an STI.
Yes.
Yeah. When a man gets gonorrhea, within 48 hours, they are screaming when they are passing out urine. It's very painful, okay? So somebody may ask, then what's the difference? With gonorrhea, you'll also find you're producing pus discharge, pus from the urethra, okay? Yes, then when it comes to other STIs, others will come with ulcers in the genitalia or in the private parts, okay? The ulcer may be in an obvious place where you can see, but a woman can even have an ulcer in the cervix where she can't see.
Yes.
A good example is syphilis. Syphilis will give you a genital ulcer. A very clean one, by the way, which does not produce pus, it's just a clean ulcer, okay? But it can even be in the cervix where a woman does not see, yeah? But if it's, for example, syphilis, it has like 3 stages that it has to go through in life. So if somebody ignored that ulcer aliona, because even if you ignore it, it can go on its own. That is specifically syphilis, you are coating secondary stage, which will eventually come. It may come after months, then you'll get to secondary, then you get to tertiary, and you'll see syphilis alone can make you mad, depending on where the tertiary lesion will be, because sometimes it ends up in the brain. So we are saying with the STIs, you'll find there is the discharge, which can be vaginal discharge in a woman, urethral discharge in a man, in addition to pain, okay? There can also be inclusion of ulcers in the private part. At times, there can also be inclusion of the swelling of the lymph nodes, which are near the private part. Yes, the swelling of the lymph nodes. I don't know how to put it, but they are usually in in the fold in your thigh, somewhere there.
Yes.
That's where we find they're called inguinal lymph nodes. Like when you have a kidonda on the leg, see, there are things that swell here.
Yeah,
those
like
are what you're
the
calling lymph nodes.
guys, like the guys.
Yes. That's what you're talking about. So you may find those that even have those.
Okay.
So they have those accompaniments in addition to maybe just pain when passing urine. Yes.
Wow.
Yeah.
You say
So
that
when
the
you
man will know something is wrong.
Yeah.
And especially for gonorrhea, you say,
Yes, yes.
within 48 hours.
Yes.
What about a woman?
A woman may take longer. Yes, a woman may take longer. Yes, a woman may take longer before they realize they have it. Some even say they can go for months. It's like they are carriers, but eventually they'll have the symptoms.
Okay.
But a man, the symptoms will manifest faster. Just like human papillomavirus, the leading among the causes of cervical cancer.
Yeah.
Women, men are carriers.
Yeah.
They're having it, but they keep giving it to women during the sexual intercourse. So what happens is that they'll give it to women. Them being carriers, it's not really harming them. Though studies have been done, and it has also been noted along there, it's also giving men what? Penile shaft cancer. But mainly, where has it been causing havoc? In the woman. It's still a sexually transmitted illness. Yes.
Wow.
But we are not saying it's only human papillomavirus that causes cancer of cervix.
No.
So that you don't judge that person who has cancer of cervix. We've said there are many causes. Maybe in another forum we can sit here and discuss about causes or predisposing factor. We say the causes of cancers are not known.
Yes.
What we have are predisposing factors.
Yes.
So HPV is one, but there are also other factors.
Other factors.
Yes.
Okay.
Yes.
Tuendelee.
So as I was saying, I was saying that there is really a distinct distinction between, because in addition to just pain when passing urine, there also be those others that I've explained. Yes, so you need to look out for those others. And of course, with UTI, you may not have it because you had a sexual intercourse. If, for example, Jane, like you're saying, your habit is the other way around, you'll have it. Even if you have not met with anybody.
Yes, yes.
Yeah? But with sexually transmitted illness, asthma, there's a history.
Yes.
Umekutana na mtu.
Yes.
It is as simple as that.
Yes.
So there's also the background information.
But it's so easy.
Yes.
Now, as you're explaining, it's so easy, but this information may not be common to everyone.
Yes.
That front, back is the way to go.
Yes.
Is the way to go.
Yes.
Is the basic
way
to go. There has been a lot of conflicts in the family.
Yes.
Like I started by saying.
Yes.
Because there's no distinction in terms of information. So if the woman has UTI, then the man may not have UTI. So the lady may not be very welcoming to the man in terms of the sexual activity. So that now there is that conflict, because anaogopa ndio asimpate simpatie, but we know it's not.
No.
It's not a sexually transmitted.
It's not sexually transmitted.
It is just hygiene.
Yes.
Hygiene. So I think
it's hygiene plus those other factors that
those other factors.
Yes.
Thank you for correcting me.
Yes, we do not want to make you feel it's because I'm unhygienic. It can tamper with self-esteem.
True.
We've said there are so many causes, including holding. When you hold, it does not mean you're not hygienic. You just held. It was a meeting. It was an interview. It was a what?
Yes.
And you had to stay there.
Yes.
Yeah. And wait.
Yes.
So please, yes, we've said hygiene is very important, the front, backward, but those other factors, please put them into consideration so that you don't get UTI. It's very uncomfortable and very painful, Yeah, so
thank you
avoid,
Thank you
because
for that
we have ways of avoiding.
True.
Yes.
Thank you for clarifying.
Thank you.
Yeah, so it's like now when we hear, like even if it's a family, sometimes, and again, I go back to what you said about we should not be shy, even to see a doctor.
Yes.
When you have those UTIs, it's good to go and see a doctor. Because I've had some ladies that sometimes they say, I have yeast and I've not gone to see a doctor, or something like that. So I think the baseline here is, let us not be shy. I don't know what you can say about that.
Well, what I would say is that UTI, at times somebody may ask, can they concur together? as in, they occur together?
Yes.
At times they can, depending on the environment.
Yeah.
You could be having UTI. Coincidentally, you are meeting with somebody who is having STD, and they infect you with the same, so they can occur together.
Okay.
So the best thing, even when patients come to the facility, you can decide to treat clinically from the way the patient has explained to you, but it's always good to carry out investigations. So you can be asked to give your urine to check for the urinary tract infections. At times, maybe the way you've given your history to the daktari, they may even ask for high vaginal swab. They'll give you something to put in their swab and take it to the laboratory to check for those STDs. You can even check STDs from blood. For example, syphilis is blood, they'll ask you to give. Okay, so they can ask you for that. HIV is STD, so they'll also ask you for that, among others. So it depends with the way you have presented. If it's just purely UTI, to be treated as UTI. If the doctor feels no, I think there's something more here, they would want to investigate you further to make sure even the UTI, the STIs are not there. Yes. And then now, maybe the other thing in prevention we can talk about is if you're diabetic, since we said it's more vulnerable, they are more vulnerable to it. It's prevalent in them. You need to make sure that your sugar levels are always well maintained. You know, if you take your drugs well, you take your nutrition well, and you follow the way you're being taught in the hospital by the doctors who are following you up, your sugar levels will be like that of a normal person. Are you getting? Because you're taking your medicines well, you're eating right, so it will be like for that other person. So that means you'll not have the prevalence of having UTI more than that other person. Then you've also mentioned about what? Still on the pregnant women, we say the relaxin hormone can entertain the holding of urine. But somebody may ask, but I thought during pregnancy women keep peeing all the time. That time comes when mtoto anaendelea kukua mkubwa and the baby is sitting on the bladder, applying pressure on the bladder. So when that time comes, don't feel shy. Keep emptying. In the process of emptying, you're actually doing bladder washout, which we say is healthy. Yes, which is healthy.
And I'm learning a lot. And I believe our viewers are also learning with me. There is a belief that may be there, that it's only women, and you have actually demystified that. And that is what I would like you probably to look into the camera, your camera here, and be able to do as a parting shot. Because women have been blamed. They have also blamed their men. So, as Dr. Josephine is concluding this, just look into the camera and let us know, is there anyone to be blamed?
Madam Jenny, if I've got your question very well, you've asked me, is there anyone to blame, especially when it comes to couple matters? I would say with UTIs, none is to blame, right? It's only that for those moments, we just need to be very careful in terms of hygiene. And it's because we've had a man can be a vehicle unconsciously without knowing, whereby he's able to transfer these microorganisms from behind to the front. So we need to be exceptionally very hygienic. And hygienic, we are not meaning you go cleaning and putting water in the vaginal canal. We've said it can be able to destabilize the pH, okay? There's really no one to blame here. It's actually a responsibility of the two of them to ensure that the activity is done very hygienically, so that nobody is left to suffer because of the same. And of course, it will avert the blame game that you're the one who caused this. And then we have said before and after. Please do not forget the 5 commandments we mentioned. Before and after, go and empty your bladder. It really helps. It really helps because like when you go before, you ensure you clean, you know, you come, participate, you finish, you go empty any residue of urine that is in the bladder, and you're left clean. You will not be able to have that predisposition of the UTI. So I would say there is really nobody to blame, but we need to get information. Like I say, and I said in a past episode when I came here, that information is power. When we have information, we are empowered. Yeah, health is wealth. Yeah, so everybody want to be well. So first of all, can you take care of that health so that it can be wealth to you? Yes, because diseases can at times be very financially draining. Yes, everything will call for medicine. Everything will call for treatment that can be very costly. So I would say that if you can be able to follow those rules, yeah. And then when we said about front, back, it applies even to that newborn baby. Yeah, that baby in diapers, that baby who is learning potty behavior, that baby who is starting to go to school, this behavior, it has to be adopted by all of us, including that old granny. The routine has to be the same, from front to the back, never the other way around. You'll never go wrong. Water is cheap, but very healthy to your body. It can prevent you very many diseases. Keep taking it so that you can have bladder washout. When you don't take water, you will be dehydrated. Yeah, other consequences will come with dehydration. Okay, at the same time, you will not be able to do bladder wash. You will not go to that urine. There's nothing to pass out. Okay, and you need to keep passing out so that you also clean out your body. So maybe somebody may wonder what happens when it goes up to the kidney. It can also cause infection of the kidney, and in addition to the way it may present, a patient may have what we call frank pains. You may feel pains in the franks, yeah? The areas where the kidneys are located is what we call the frank area. So you may feel pain
at the
there.
back, huh?
Yes, here, yeah? The place when you hold yourself akimbo. Yes, yeah, when you hold yourself akimbo. Yes, you can have pain there, especially when the infection has already gone to the kidney and it has started causing inflammation in the kidney. At times even you can find the kidney is full of pus just because of that infection. So during that time, or in UTI generally, especially that which has taken some time before you start treating, you may even experience fevers. So in addition to the ones that I listed, you can also experience fever and malaise. The body is tired. You can also have some lightheadedness, some slight headache. So there's general feeling of unwell. You feel unwell generally. Okay, you feel sick, a headache there, fever there, malaise there, you don't have much energy. You feel sick, you feel sickly because of urinary tract infection. Yes, so in addition to those that we gave, please add on to that. You may have to look at that also, which is very important, especially for the children. A child may not be able to tell, or you may not even know that when they are passing out urine, they are feeling pain. You may not note. They are in diapers and the like. So a fever at times can be a sign that a child is having UTI. Or even you as an adult, you may start having the temperatures have started rising. Yeah, that's why whenever you take a child to a pediatrician, in addition to what they think the child could be suffering from, tonsillitis, yeah, upper or lower upper or lower respiratory tract infections, or other infections, they have to think of UTI. A child may not say they have it, but just a fever alone can be an indicator that a child is having urinary tract infection. So what is needed? You'll be asked for urine to be taken to the lab, and if indeed this child has UTI, the child will be treated. So that's also something that I felt it's very important that in addition to what I gave you, please add on to that. Fever can be in an adult or even in a child. And at times in a child, that can be the only thing that is actually giving that child fever. Yes, in addition to all others. We know there are many infections in a child that can give fever, but UTI is one in the list. Thank you so much. And
probably never thought about. I mean, yes. Somebody may not think about it.
Yes, you may not think about it. It may not be closer to your thought. Mostly you think of tonsils, tonsillitis. Yeah, maybe the child is having diarrhea, abdominal pain. You think it's purely that. But this fever, especially this fever, the child goes coming back. The fever is still there, no malaria, no other things. UTI can also be a cause.
So it is good to rule out anything
it is good
that you
to
may
rule out.
think
Yes.
may cause.
When there is no obvious cause.
Yes.
What happens is, like, if, for example, they now come, you've confirmed maybe the tonsils are inflamed, they have tonsillitis, or they have laryngitis, the throat is sick, it's a chest infection, whatever it is, yeah, you can check, you can treat. What we believe is that the antibiotic we give may even clear the silent UTI that may have been there, okay? But when you see you can't trace the cause of this fever, think of UTI. Yes.
Don't ignore it.
Don't ignore it.
Okay.
That's the word.
Wow.
Yeah.
Thank you. I'm lost for words because of this information that is so critical, that we require, each and every one of us. As you have said, it is not, a specialty for a particular group, like for women, as much as we may be affected more than the men. And the small baby, we should never forget that baby. So thank you so much. And again, I would say, thank you for finding time to come and be with us once again. Not forgetting that small baby, because we may, most of the time, forget that baby. We think it's only for adults. Let us also, one very important thing that I've also picked from you is, let us train our house helps. Let us train them on how to handle our babies, because that way we have started mapema, we have started early. And again, front, back, my viewer, front, back. And I think that way we are preventing ourselves. And I say in another episode that we are doing self-care and we are loving ourselves. And I want to really say that I think this is the most exciting episode that I've held, because I think it is so practical, and I'm looking forward to others. You said when you're introducing yourself that you've done you are a forensic expert.
Yes.
You're going to tell us where you do that forensic work in terms of part of our bodies. You'll come back here.
And to the community.
Where does it come in? So that we can be safe, even legally and all that. We'll come to that, because I believe you're going to get some more time and grace our screen again. Thank you so much. Ukienda back to JKUAT, endelea na kazi mzuri unafanya. And to our viewer, keep watching Health Now Show. It is your health friend. And until next time, God bless you and goodbye.